Hey there, it's Dr. Jim, and I want to talk about universal precautions. If you're in healthcare, you hear about this all the time. If you're not, maybe you don't. So, my topic today is the importance of universal precautions in senior care. This is a timely topic. I don't know if you're paying attention to the media, but with the serious outbreak of the coronavirus in China and its appearance now in other parts of the world, including the cases that we're now aware of and hearing about almost on a daily basis now in the United States, healthcare professionals must take universal precautions seriously. While the chances of coronavirus infecting anyone in senior care appears to be extremely low, taking precautions against bacteria, against fungus and viruses and parasites and all these other bugs, well, these should remain at the forefront of every healthcare professional's mind. I know when I go through any facility whatsoever, care community, washing my hands before I go in, I'm washing my hands if I touch something, I wash my hands if I enter a resident's room, wash my hands on the way out, wash my hands before I leave the building. Dr. Collins has left the building, and he has clean hands, I'll tell you that. So, universal precautions, these are perhaps two of the most important words in healthcare and senior care today. It is way too easy to spread bacteria and viruses from place to place and from person to person. All it needs is a touch, or cough, or sneeze, or people to blow their nose in a tissue and then they leave it on a counter. You might as well just infect the whole thing. Healthcare professionals should treat all blood and body fluids as if they are contaminated and they are potentially infected. The Center for Disease Control and Prevention, I would check out that website and see what's going on with corona and some other bugs, has developed precautions and guidelines to reduce the risk of spreading common germs like strep, staph, E. coli, the common cold, the flu, and HIV. We could take none of these for granted. You get E. coli infected in food and you get it out to restaurants and supermarkets, people start eating it and becoming very ill and sometimes die. There are chains of restaurants that have gone under, belly up, because of E. coli and other germs. So 5 ways, remember these 5 ways that germs are transmitted? The CDC has provided good information to effectively reduce the spread of germs that are airborne, like Legionnaire's disease, and the coronavirus. Freaks me out every now and then, staying in a hotel, doing business and whatnot, and, Legionnaire's, is it in the air ducts? Droplets, where do we get droplets? The common cold and the flu and TB. Let's not forget about TB in that one. If you travel a lot, like I do, I'm in airports, and I'm not paranoid, but I'm cautious and careful. Blood and body fluids, like from STDs and HIV, skin to skin, ringworm, pink eye that my little girl Karina gave me a few years ago. Thank you, school and children. And then oral and fecal, where do you get that? Hepatitis A and E. coli. So these germs travel from place to place and person to person when the infected person coughs, sneezes, or touches something or someone with their hands. The germs then find their portal of entry on the individual. Is it my eye, the mucosa membranes of my eye, my nose, my mouth, so on and so forth. And then that person becomes potentially infected. And of course, the chain of events then repeat themselves over and over and over. But I'm not going to repeat myself over and over. My name's Dr. Jim Collins. Remember the importance of universal precautions and remind your colleagues. Take care.